When it comes to cardiovascular care on the organizational level, MedAxiom, an ACC company, understands the challenges your program is facing. Welcome to MedAxiom Heart Talk, the podcast where thought leaders come together for one ultimate goal: to continually transform and optimize cardiovascular care for all. MedAxiom Heart Talk starts now.
I'm Cheryl Toth, host of MedAxiom Heart Talk. Today, we continue our weekly COVID-19 briefing, bringing you answers and insights from physicians and administrators on the front lines, as well as MedAxiom consultants. Given that so many members posted questions to the listserv about coding for telehealth visits and phone calls over the course of this last week, we're going to focus today's briefing on addressing this issue. So joining us from Crossett, Arkansas, is Lori Walsh, MedAxiom's Executive Vice President, Membership and Operations. And from Jacksonville, we have Nicole Knight, MedAxiom's Vice President, Revenue Cycle Solutions. Thank you both for being here today.
Thank you.
Thanks, Cheryl.
Glad to be here.
So Lori and Nicole, before we get into the coding questions, we have some positive news to start today's weekly briefing with. And Lori, tell us a little bit about the CARES Act payments. They're starting to come in, and members are starting to see big deposits into their accounts. Yes? Tell us about that.
Yes. So this morning, we heard from a couple of members that they had surprise deposits in their accounts, which is always great news on a Good Friday morning, especially in the current environment that we're living in. So the details went out over the MedAxiom listserv, so you can find more information there, and also there's information on our COVID page. But the short answer is there was some payments to provider for funding relief, and it was about $30 billion in funding that was distributed. And it's based off of the payments you received in 2019. There is a formula that you can find on HHS's website, and we'll link that again within the show notes here, as well as on our COVID page. But anyway, you got to attest that you received the money within 30 days of receiving it. I don't know that everyone will receive it today, but we did start seeing deposits today. And HHS has partnered with United Health Group to deliver the funding through several different banks. So you may see the funding in a remittance through United Health Group or through CMS. So again, go out to the COVID page to get more information, but that website from HHS is www.hhs.gov/provider relief.
Great. Yes,
so, great
super
news.
Information for a Friday, positive information for a Friday. Nicole, do you have anything to add to that?
Well, I think the best part is the exciting part was to see that in the letter that's posted that these payments were not loans and that they don't have to be repaid. And I think that that's some good messaging that we do realize how much support we are actually getting from CMS and other federal entities to help through this turmoil in the country.
So great. So that's great news to kick us off. Now let's talk about the focus of today's episode, which is addressing the myriad of questions that have been buzzing over the last week on the listservs. Nicole, I wanted to ask you, what are the most common questions you're getting, from calls, emails from members, what you're seeing on the listserv? What is confusing people, and how is MedAxiom poised to help?
Yes, I think the biggest confusion has been around the telehealth regulations that were released by CMS Medicare, because they have been trying to keep up with the influx of information as well. There's been a lot of miscommunication about telehealth and what telehealth is. We've tried through our webcast and our resource page to provide some details about what are all the services that are included within telehealth or in telemedicine. And when they talk about telehealth, the biggest confusion has been around for Medicare truly to bill for our regular visit codes, our evaluation and management services, the CMS definition of telehealth is that service has to be provided via video and audio. So the confusion has really been around that audio video portion, because along with that release, CMS also relaxed several guidelines around audio only and virtual services. And I think that has been the biggest contention of confusion.
So one of the questions I noticed, well, there are a couple, I think, that were related to this, people talking on the listserv about what happens if you can't get the video to work, you try, and so what do you do in that case? Do you bill it as a video visit because you tried, or is it a phone visit? What's the code?
Yeah, from a federal perspective, which from a MedAxiom community, we take those federal guidelines, we digest them, and we try to provide that real-time information to our members and cardiovascular organizations. And when you look at the specific guidance, they don't have the black and white answer to that. What I can tell you from interacting on several of the CMS telephone calls and open forums, they have stuck to that in order to bill those regular visit E&M service codes, you have to have video and audio. So in my mind, if you were not able to connect and you did not have that video piece, you have to look at those audio services. There's been a lot of confusion around, could we document we were unable to connect? Unfortunately, I don't have any black and white that can tell you that that's what would pass from a CMS perspective. They have stuck to the tagline. It has to be audio and video for that reimbursement. And
this guidance, is this some of the information that's in the coding tool, the telehealth coding tool that you have on the COVID-19 resource page? Like, would the audio visits you're talking about, is the code range in that tool that you could refer listeners to?
Yes, so we have a virtual service tool out on our COVID resource page at medaxiom.com, and it breaks down the services by the CMS telehealth services, the virtual, what they consider check-in services, audio only or telephone visits that they've allowed, also e-visits, which are referred to as our, also e-visits that are referred to as our electronic medical record or portal visits. And then we've also added additional services that are in existence that may help with managing patients at home, such as remote patient monitoring codes, chronic care management services. So that tool directs you in many ways to look at what are the requirements, what should some of the operational components look like, what are the codes, what is the national reimbursement, and gives you that sense to look further if you need additional information for specific details, but does provide a lot of context.
So that tool can be downloaded. It's a Word document or a PDF, as I recall, from the medaxiom.com/COVID-19 is the URL. That's the resource page that you're adding to on a very regular basis now. And the coding section is where they'll find that tool. And it's updated with new information as you receive it and digest it from the federal guidelines. Am I correct?
Yes, we have updated it every week. This is the first week that we don't have any impending updates as of now. CMS is famous for releasing information at around 6 p.m. on Fridays, so we will be watching for that.
Great. And so a great tip, I think, is for listeners to download that and make sure that that's distributed and understood by anyone related that's working on billing, or make sure that everybody is following the guidance properly, since we have digested that for you specifically to CV services. So that's a great tool. Nicole, other coding issues that you want to raise that you're hearing this week that are sort of the hot button issues from members?
Yes. Yeah, so there's a lot of question around phone or audio and what counts towards that time. So Medicare did allow us to bill and get paid for the series codes that were not allowed previously for telephone visits, which are 99441 to 99443. The coding specifically is around the actual time spent by a physician or a qualified health provider, which is designated as our advanced practitioners, nurse practitioners, PAs. Those audio codes are not specific to clinical time. We have had a lot of questions come up. Will they let us count that clinical time and crosswalk this in the future? Unfortunately, we have not received any guidance on that, but it never hurts to document all of that information within your documentation, especially if there is some sort of crosswalk that does develop as we continue through the public health emergency.
Well, that leads to another question about documentation elements. I've seen a few people posting on that, and you mentioned that specific to the phone visit codes, but with so many people now switching over to telehealth and they hadn't billed for those codes before, are there any specific things you want to make sure folks are documenting in all of these virtual visit telehealth codes that may be different from what they've been used to?
Yeah, I think the big thing, takeaway message there has been really documenting how you're connecting with the patient. So is it audio and video? Is it audio only? Is the patient located at home? What is the location of the provider? Some folks have even been adding that the patient is being seen within the COVID-19 public health emergency time period. Also that the patient has given consent. These codes do require an annual consent from that patient. So a lot of workflows have been adapted to capture that documentation. And then obviously documenting that medical decision making that was used to provide that service to the patient, which we're very familiar with documenting those elements. It's just these little idiosyncrasies that have caused some confusion, but the more documentation, the better. And in this case, we don't have to document all of our histories on telehealth visits. Use that to document that location, the technology used, those types of things, so that we have that as a reference to go back to.
Great. Other coding issues that we need to be aware of this week?
Yes, so what I would say from a commercial payer standpoint, commercial payers have followed suit with Medicare. Unfortunately, that has not been very timely, and it doesn't totally align with the CMS Medicare telehealth guidelines. So having someone who is monitoring that information and consistently updating it and communicating it to your internal teams is important, as well as your individual state Medicare. So we always refer to those as our MACs. Those are our state Medicare contractors. They have not updated their websites. Some of them still have the existing telehealth rules from rural health. They have not updated their fee schedules. So there's a lot of those challenges out there. And unfortunately, we don't know when all of that will be corrected. So looking at, should I hold my claims until some of this is updated by our carriers? Should we look at how to have some safety nets in place if we do file claims, that we can manage these denials and reduce our rework on the back end?
What advice do you have for practices and programs to manage that process? You know, you're talking about communicating as a team and monitoring these sites, but is this, are you seeing out there in practices and with members weekly meetings or email threads, or how are, from a practical standpoint, how are administrators managing all of that and making sure that everybody's sort of singing from the same song sheet, as it were?
Yes, definitely. So what we've heard from our members are that they've established, of course, these calls around COVID for many different aspects of their organizations, but they truly have in their revenue cycle departments designated 1 up to 3 people or a team of folks that are monitoring these payer websites and updating a centralized document that's shared across the program or system so that everyone is able to stay up to date. Also, what several groups are doing is they're not putting this on the physician to look at who the payer is and decide how they're going to bill it, but they're relying on that physician and providing that communication to the physician to have solid documentation, but taking the burden off the physician on exactly how to crosswalk the code. That's happening on the back end in most cases.
Great. Well, those are the hot topics of coding this week. We're going to continue to bring these to your attention in future weekly COVID-19 briefings. And as a reminder, all of this information is on the COVID-19 resource page, which MedAxiom has provided at medaxiom.com/COVID-19. There's an email that goes out every week. Lori, you do that, and you kind of give an overview of all the things that have been added. And I mean, gosh, there's been so many webinars and other things. There was one this week on how to survive the financial tsunami. Anything you want to add about what is on that resource page for listeners to access?
Sure. Yeah, I mean, again, we are sending out those reminders over the listserv with the new content. We're trying not to inundate folks' inboxes with a lot of emails, but also we want you to know when there are updates, because we realize that people are using resources that are outdated. So when we send those over the listserv, please make sure you read them. And the information that's going over the listserv is also published on the COVID resource page. And again, it's being updated at least a couple times a week, but sometimes multiple times a day. I just sent 3 links a few minutes ago to our marketing team to add to the resource page. So again, mark that resource page, send it out to your staff, make sure they're looking at it every day, and reading through the content and redistributing new updates. For instance, the coding tool that Nicole's team put together, that's been updated. So the old one needs to be thrown away and use the updated one. It's really important that you get the most up-to-date information. And this is an overwhelming time for a lot of our programs because they're changing their policies and procedures in their programs even weekly. So I think it's important. We're hearing from our members that it's really hard to keep up with all the changes. So find your resource and keep using that same resource. And we hope that MedAxiom is that resource for you for all of your COVID information.
Good practical advice. Let's close with a story of the week. We like to close these briefings with that. Something that happened in the last week that was either an innovation or something courageous or something that is worth sharing to listeners today. And Nicole, why don't we start with you? What's your story of the week?
Yeah, I think my story of the week is from our members who have shared stories of how happy their patients and family are to be receiving these virtual services and being able to continue to connect with their providers through all of this. Our cardiovascular patients have a lot of stress, and I think having that connection, whether it's through video or a telephone only, has proven to be priceless in regards to them feeling connected to their providers.
Great. I love that angle, thinking about telehealth bringing, it's virtual, but it's really bringing people closer and feeling that sense of connection. And Lori, why don't you take us to the finish line? What's your story of the week?
So my story would be the personal emails and phone calls that we are receiving from our members thanking us for the work that we're doing. We're all working at a really fast pace right now, and MedAxiom is trying to deliver up-to-date information as quick as possible. And to hear back from our members that they appreciate our effort, they're using our resources, that really makes us all smile and work harder to make sure that we're meeting the needs of the members. So keep them coming. We appreciate the feedback, and we hope to continue to provide you guys great information through this pandemic.
Excellent. Lori and Nicole, thank you so much for being here on a Friday morning. Appreciate you being our guests today on our weekly COVID-19 briefing on MedAxiom Heart Talk.
Great. Thank you so much.
And thank you, everyone, for tuning into this week's COVID-19 briefing. Don't forget, medaxiom.com/COVID-19 is where you'll find the resource page. We'll continue to bring you these special short episodes which address the most pressing COVID-19 issues facing CV programs and practices each week. And if you're enjoying these special programs, as well as MedAxiom Heart Talk, please tell your colleagues. They can subscribe on Apple, Google, or wherever they get their podcasts. And if you'd like to give us feedback about the podcast directly, send an email to hearttalk@medaxiom.com.